Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest has not been mentioned by our kind doctor. So we're just going to take you through a general idea of what is going on in this CBCT. On the 3D rendering, you can very clearly see there's very severe bone loss in the anterior segment between the central incisors on the lower right and the lower left segments. Now you can see this bone loss has a periodontal defect. This is where the incisor, we're presuming there's an extraction socket present here as well. So we're presuming that there was a tooth to a central incisor which was extracted. We can see buttons, and we're presuming this patient is going through significant aligner treatments, and that is visible on the 3D rendering. On the panoramic view, you can see this is where the tooth was extracted, and there is significant bone loss between the two, the central incisor and the lateral incisor on the right hand side. My apologies for mentioning the central initially. We had not seen that there was an extraction. We can also see that there is a lot of tipping instead of bodily movement of the teeth as a result of this aligner treatment. So when we look at the transaxial view, which is basically the proximal view, or the side-to-side view, you can very clearly see that this is where the extraction socket is. We've got no bone healing at the moment. When we look at the mesial aspect of the lateral incisor, we have bone loss, but the buccal and the lingual areas are relatively better. This is the central incisor. This central incisor, even though it has a button on it, also has significant bone loss, especially on the buccal aspect. When we move to the lateral incisor has better bone support. The canine also has very good bone support, but the central incisor unfortunately has very minimal bone support and also has periodontal disease associated with it. The rest of the tooth, the upper jaw, seem to be doing very well. We don't see any major periapical radiolucencies. This is the canine. This is the 6. Again, very curved roots, but the sinus seems to be clear. This is the upper right 8. Again, has a class 1 to class 2 cavity. You can see that here. So this is something of note to the patient, might cause patient peer problems later on. This is the upper left molar, has a button on it. This is the upper left second molar, has a button on it, and this is the upper left third molar, has a cavity. So that's also something to be kept in mind. This is the lower left 8, the lower left 7. This is very interesting. On the panoramic view, you can see that this is a hyper dense area in the bone. But when we look at the transaxial view, it's not associated with the tooth. It's actually a osteosclerotic, idiopathic osteosclerosis present in the tooth. As you can see how thick the cortical plate is, and the 7 has curved roots, which you can see here. So extracting the 7 is going to be a challenge, something that we have noticed in the CBCT. It's not a pathology. It's not something that we can see as bony expansion, but it is definitely something to be kept in mind. This is the lower left 6. Again, has a button on it. Things seem to be doing okay. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.